morning, everyone. This is Amy Broadbent with JRG Advisors. Thank you for joining us. And before we get started on the workplace wellness subject, just a few housekeeping items. We have with us today Dave Cipino, who is the co-founder of Health Keys, one of our strategic partners that we will learn much more about today as we talk about some new trends and new concepts in wellness. A few administrative items. If you have any questions during the webinar, please type them in the box on the screen and hit send. We will answer all questions at the end of the webinar. Copies of today's presentation will be shared with everybody who is in attendance within the next few days. And we will also be recording this webinar, and there will be a replay available that is included with the presentation. So again, thank you all for joining us. We are going to go ahead and get started. Our first screen, just want to welcome all of our clients and valued partners, and you see a representation there of some of our strategic partners. Workplace wellness is not a new subject or concept, but there are some new trends that seem to be gaining popularity because they include tools that now enable employers to measure results, track improvement, and really ultimately offer the employer the ability to quantify their return on investment in a wellness program, which oftentimes is feedback that we hear from the president or the CFO, the financial person or the decision maker at a company, is they truly buy into the concept of wellness, but it's difficult to realize or measure that return on investment. So much of the momentum surrounding the renewed increase in workplace wellness that we're seeing is the result of what is referred to as a lifestyle disease epidemic in the U.S. And we're seeing far more increased cases of chronic diseases such as diabetes, cardiovascular disease, chronic pulmonary conditions, and you can see on the slide what's really driving that. And the increase in the levels of obesity, even childhood obesity, physical inactivity, poor nutrition. And the onset of these conditions are really shifting to a younger age population than we've seen historically. That population still participating in the workforce, which leads to concern among employers, who you can see here that studies show 67%, which is a high number of employers that are saying an increase or in concern in employees' poor health habits is one of their top 3 challenges when it comes to maintaining affordable health care coverage. And everything, nowadays for every employer, regardless of size, affordable health care is a big deal, huge concern. So moving forward, this slide shows some of the examples of the financial impact that these chronic diseases and unhealthy behaviors are having on health care. Obesity, alcohol and drug, tobacco, preventable illnesses accounting for 75% of the burden of these increased health care costs. And preventable illnesses are those illnesses such as high blood pressure, high cholesterol, heart disease, your obesity, again. These are considered preventable because more often than not, they are the direct result of individual choices or behaviors. So if an employee takes more responsibility for their own health or improving their own health, ultimately, medical costs can be reduced, which really is one of the objectives, obviously, of workplace wellness. We're finding that more and more, because employees, we spend so many of our waking hours at work and at the workplace, that this really does become an ideal setting to address health and wellness. And one of the benefits for an employer, obviously, is, if you're taking an interest in the physical well-being of your employees, shows your commitment and that you're, committed to improving their health, along with all of the other benefits that we see listed on the screen, which is nothing new, but certainly, improved health and morale, productivity, a reduction in absenteeism or sickness, increased presenteeism, certainly stress and coping skills, and then even the social support as you try to build the camaraderie among coworkers and peers to try to build that teamwork or that approach to getting everybody engaged. And ultimately, the last bullet there, again, getting back to medical costs and the healthcare, but ultimately trying to improve behaviors and improve medical conditions, driving lower health plan costs and utilization. So moving forward, looking at where wellness, as we said, workplace wellness is not a new concept. And we're not going to spend too much time on wellness of the past, but I think it's important to just kind of talk about where we were as we look to what really is new and unique going forward that we do want to dive into today. Wellness has certainly always been viewed as an employee benefit or a perk, and a lot of this getting back to, the team building and friendly competition. I think we've all been exposed or accustomed to like the 10,000 steps type challenges or the Biggest Loser campaigns, which are all great in theory, but the problem that we've realized to date is nothing with these programs really enabled employers to measure or quantify results or to track improvements from year to year. A lot of what we've been accustomed to is insurance company driven or specific. A lot of it is web-based and more of a point-and-click type program or approach versus any real kind of data management, making it really, again, difficult to measure outcomes, results, or improvements from year to year, or any way for that employer to really track their return on investment. The one thing that has been consistent or remains consistent is the health risk assessment, which if anybody has completed or participated in workplace wellness programs, you're used to the health risk assessment or the JRG and how that works and what it looks to accomplish. So that's still a big component of wellness today as we move forward. But really the new trends, and this is where we're going to get into health keys and a lot of the tools. One of the real advantages is that it takes wellness from being truly an HR type role or function now to that C-suite that it can really have an impact with the owner of the company, the CFO, in driving results in the data and how we can measure costs. So all of this gets far more sophisticated, new ways to identify incentives and get employees engaged. And really, this whole new approach, everything is data-driven and ties back to the ability to use this data to manage risk. And when we talk about risk management in insurance, we're all used to hearing that more as it relates to property and casualty and the other side of benefits, not necessarily health care or being tied so directly to a medical program. So the capabilities of this data and how it can improve outcomes is such a big deal, and how employers can identify specific issues and risk factors and now develop strategies to address these and really impact change. So this is where I'm going to, again, reintroduce Dave Cipino and ask him to weigh in and get into more detail as far as health keys and what they offer as this new solution that would love to bring to all of you on the call today.
Well, thank you very much, Amy. And if we turn the page, when we talk about managing risk, again, not necessarily a new idea, new in the wellness arena, because of the type of data that we're now accumulating, as well as the ability to do something with that data, that has made a large difference in outcomes. So what we've done was basically take from workers' comp and the property and casualty side and borrowed their ideas and simply applied those ideas to wellness. So we identify risk, and we attempt to minimize self-reported data. That has been part of the problem that we've faced in the early years of wellness, in that the self-reported data wasn't reliable from a risk management standpoint. So that's one of the reasons we went to biometric screening. That is verifiable data. And many employers are now going to screenings for their employees. And that is mostly done on-site with various biometric screening companies. And you'll screen things like for body mass index, cholesterol, diabetes, and so forth. But again, that's verifiable information. We still use health risk assessments. That's self-reported data, but it is still good data, and it allows the employer to get information on an aggregate basis, not on an individual basis, but an aggregate basis on things like stress and other items that we can't really measure through biometrics. Medication adherence is one of the big newer items that we are now measuring and managing through this risk management type approach. So while we collect the data on biometrics, we also collect data on whether folks have received medication prescriptions, and simply bouncing the data off of their screening results and the answers to that question gives us some indication as to whether or not they're adhering to their medication regimen. Interestingly, about 50% of all people that get prescriptions do not adhere to their medications. That has an enormous impact on claims and productivity. So that's something we want to take a look at, manage, measure, and then report back to the client. Age-appropriate tests are another area that we really focus on as a tool to help manage the risk prospectively. We want to get the claims that we want to eliminate claims that may be coming in the future, and we do that through medication adherence and age-appropriate tests, as well as some of the other items that we've listed here before. We evaluate the risk. So identify, evaluate, we use predictive modeling tools and reporting. The evaluation of the risk is something that becomes important so that the client has an idea of the amount of risk within their group and gives you an idea, a roadmap of where to go. We use risk stratification report to identify the highest and lowest risk in employees, and then reach out with our coaches to help manage that risk as we go along. The management of the risk starts with outcomes-based incentives, and this is relatively new in the marketplace and has created a wonderful opportunity for employers that are interested in truly managing the risk within their group. It's not for everybody because this creates a level of employee accountability that really we've never seen before in wellness. The way this works, real briefly, is that the outcomes of biometric screenings, employer contributions to the health plan are based on the outcomes of biometric screenings. So as employees improve their results, the employer may contribute more to the health plan. Very interesting way to attack the health of employees and to support them along the way. We engage with wellness coaches. That's part of the support that I was just referring to. Wellness coaching is ongoing and unlimited, and of course we use education and communication that is relevant to participant needs. So the whole management of the risk is an area that we really haven't seen too much of in the more traditional wellness programs, but in a risk management program obviously is extremely important. Measuring results is, as Amy mentioned earlier, something that really brings the C-suite involved to the program, because it becomes very important to measure results. You can't manage what you don't measure. So we compare year-over-year improvements. We have aggregate reports. We measure coaching efficacy, and we measure the value of the incentive. So that's a basic risk management program, and since incentives are such a big part of it. And by the way, incentives, the Affordable Care Act devoted about 20-25 pages to incentives alone. So it seems to be important in the Affordable Care Act, and our view is, like most, now that the Affordable Care Act is here, we might as well take advantage of what it brings to the table. And incentives, defined incentives, helped all of us determine the best way to go forward for those companies that feel incentives are appropriate for them. And this slide here shows the type of incentive and the impact that it might have. So Amy mentioned 10,000 steps. That's a very common type program. And so many employers do incent participation in 10,000 step programs. That's considered an activity. And the reason we have type there, the amount of incentive and how it is applied differs based on whether it's an activity, participatory, or results-based. But that is self-reported data. And this gets to the heart of the difference between an outcomes-based program and a program that is more of an employee benefit. Self-reported information means that the employee goes into the system and tells you that they walked 10,000 steps. Some do, some don't. We all know that. Unfortunately, we don't have any way of knowing who has or who has not. As long as they report it, they get in the sample incentive a $20 a month incentive. And what CFOs and employers are beginning to ask is, what have I really accomplished by incenting someone to go in and report that they walked 10,000 steps? We can't determine whether they did or they didn't, but nevertheless, they get a nice incentive, and that's what makes it an employee benefit and something that is valued by employees. Complete an HRA, that's participatory, it's verifiable, at least you can tell if they completed it or not. And in this example, the contribution is a $100 HSA contribution. You'll notice on the sample incentives, there's a variety of ways to incent. It's becoming an area of unique consultative experience just because the rules are so new. And employers are beginning now to get their heads around and arms around what it means to them. Complete screening, that's verifiable. Again, in this case, it's a surcharge. Do employers surcharge? Do they incent? That's part of the consulting that employers are now receiving from their benefit consultants and wellness consultants. BMI of 29.9, that's an activity. In this case, it's an activity-based. It's self-reported. We're saying to the employees, go in, tell us what your BMI is, and if it's at a certain level or lower, then you get a reward. In this case, you qualify for the high option medical plan. And if it's too high, then you go in and self-report information about maybe a program that you read about online. And if we look down the list here, you can see that there's some self-reported and some verifiable type information. And that's the issue that when we start talking about incentives, do we incent for verifiable information? Do we incent for self-reported data? The more information you report that's self-reported, or the more information you incent that's self-reported, the more of an employee benefit it is, the more information that you incent for that's verifiable, the more of a risk management program it is. So this is all customized and has to be unique to each employer. And Amy, I'm going to turn it over to you for the summary.
Thank you, Dave. So again, in summary, you know, it's changing times. I mean, the market is changing. We all know all too well. But market conditions, employer demand have really driven these new approaches and tools to workplace wellness. As Dave said, customizing these to every employer's unique needs is key today. And it really is, the data is driving all of this back to being really part of your long-term strategy. And a successful wellness program can work, you know, we want to match the employer's decisions with the results, make it something that appeals certainly to the employees overall, but take it beyond becoming an HR tool and function, really to supporting that CFO and the financial decision maker into fitting that long-term strategy, realizing the return on investment, and ultimately improving outcomes for the employees and improving their health and their behavior. So we are really excited about our partnership with HealthKeys. We would love to work with you to develop a health and wellness program that fits your needs and to talk about all of this in more detail. It definitely, you know, is a new approach. There's a lot to take into consideration, but we hope to work with you, and we welcome any questions at this time.
And we do have a couple questions, Amy, and I'll go ahead and read the question and then answer it. Is it really legal to incent the results of a biometric screening? What if someone has a medical condition that prevents them from reaching a goal? Great question. And the rules that are in the Affordable Care Act and that have since come out through the EEOC make it very clear that, yes, of course, you are allowed to incent based on the outcome of biometric screening, but there are very strict rules that you have to adhere to, and one of those rules are that a patient has to have the ability to appeal, and you must provide them with an alternative. So if someone is in the middle of treatment for something else or has some medical condition, or a common example would be the best they can get their cholesterol is at 200 and the magic number is 130, then you simply get some information from that person's doctor and you use 200 as the number that is used for incentives. So very specific rules that must be met. And here's another question. What is the ROI of an outcomes-based program? Another great question. Much of what's gone on in the wellness world over the last 18 months is new studies, new reports that have emerged. And we develop our product, and others have too, based on this new information. And return on investment is no longer a calculation that most of us use, and the reason is twofold. There was a study done by the RAND Corporation. It's an independent study that indicated that return on investment on some of the more traditional wellness programs, the employee benefit style programs, is negligible. We always had anecdotal information to that effect, but as it turns out, they did a study with 20 or 30,000 people over a 4 or 5 year period of time, and it kind of confirmed what we thought. And then more recently, the HERO report, Health Enhancement Research Organization, kind of confirmed the same thing and basically said that ROI can only be calculated on groups of 25,000 or more. So what we use is program efficacy. And what we do is we measure what you incent. And most companies that do outcomes-based are incenting improvements in biometric screening, so that's how we measure improvement in the program. Are employees actually getting healthier? Okay, we have another question. Which is more effective, incentives or surcharges? Another good question. And kind of a tangent question is, do you incent or do you use surcharges? That's up to the employer. Most often it's a budgetary issue. When we do consulting with our clients, it's one of the things we talk about. And if the budget is tight, the employer may have to use surcharges. Surcharges are when employees pay. Incentives are when an employer pays for a particular outcome. And interestingly, and maybe not so surprisingly, surcharges are more effective. We would all prefer to use incentives, but surcharges are more effective. In other words, a smaller surcharge, say of $10 per employee per month, versus an incentive of $30, is more effective because it's a surcharge. You're taking something away versus giving something. So again, great question. So the answer is surcharges are a bit more effective, but it's really up to the employer to determine whether to use incentive, surcharges, or some sort of combination.
All good questions, thank you. And we will include a summary of the Q&A with the webinar presentation when it's shared. Our contact information is on the screen. Thank you all for joining us today. We hope to hear from you soon, and have a great day. Thank you. Thank you, Dave.
Thank you.